Hi, welcome to Child at Heart today. In today's video, I'm going to be sharing with you postpartum trauma. This particular postpartum trauma is something that I experienced and I was able to overcome it when I had my son. And I'm going to be sharing with you few things you can be doing or what you can do to help relieve yourself of this particular postpartum trauma. We all know that after delivery, after childbirth, there are different stages, there are different things that women encounter in their body that results to postpartum stress, postpartum trauma. But I'm going to be sharing this particular postpartum trauma that has to do with the wrist stress, wrist trauma, which medically they call mother's wrist, or it's called a wrist pain. Professionally, it can be called Quaverns tenosynovitis. And what you can do as a person or as a mother that is recovering from postpartum, or perhaps you have someone that is experiencing this particular postpartum trauma that people usually do not talk about or usually do not even know what to do. I, for one, experienced it after I had my son, so I would like to share with you what you can do to help relieve such particular postpartum trauma. So the first thing I'm going to be sharing with you, the first is rest and elevate. So when you rest and elevate, you're able to give your wrists a break by resting them on a soft pillow or cushion, either on your bed or in your sitting room. And when you elevate or rest them slightly, it reduces swelling. Peradventure you have swelling, and it will relieve the pressure and the pain you have on this wrist. Second you can do is apply ice or heat. When you apply ice or heat, it has a way to cool the pressure or the pain you're experiencing. Applying a cold compress of ice pack on the wrist, the particular part of the wrist, for like 10 to 15 minutes where you're feeling pain. Several times in a day. You can do it for like 3 to 4 times in a day, each time for 15 minutes. It can help reduce inflammation or even the pain or the pressure you're experiencing in that particular area. Alternatively, you can actually apply heat. Either you use a hot water bottle to also help soothe the pain. The third step you can actually take to relieve yourself of this particular postpartum stress, this wrist pain, is to engage your wrist in some kind of stretch and exercises. You can actually use the wrist ball or the fine motor ball. Some people call it the stress ball, to press, to compress and relieve. It kind of helps to exercise your muscles and the veins around that particular area. So by gently rotating your fingers or your wrists, it will aid in blood circulation. Peradventure blood is naturally flowing well in that area or in that region. It helps blood to flow by the time you rotate your wrist. So you can actually engage in this exercise once you wake up and before you go to bed. This rotation of your wrist and your fingers is going to allow your blood to flow properly in that area. You can actually flap your hands, flap your wrist, and then try to do some kind of exercise in that region. It's going to stretch it out and allow easy flow of blood. It also helps to soothe the pain in that area. You can try this 2 or 3 times on a daily basis. The fourth I'm going to be sharing is what I've seen a lot of people engage in that actually helps. It works of a brace or a wristband. Yes, they tie it around the wrist area where they're experiencing pain. It actually helps to contain the pressure and the pain. After a while during the day, they can take it off, or probably when they want to go to bed, they take it off, depending on how it works for you or how you've been advised to actually use it. The use of this wrist, the use of the brace and the wristband will also help you. Eventually you want to lift your baby, or you want to lift something, or you want to engage in some kind of exercise, a badminton or table tennis. It will help hold the pressure or the pain in place, and also has a way of reducing the pain. The last point I'm going to be sharing, which is actually not the least, is to consult professional help. In the journey of your recovery as a mother, as a new mom that has just given birth. Journey of recovery involves you to always be in contact with your doctor, so that you're sure that whatever you're doing, whatever you're engaging in, even this points that I've actually shared with you, is something that you can reiterate with your doctor, reiterate with your professional physician, to be sure that you are in line. When you have tried everything and you've seen that none is working for you when it comes to this particular postpartum trauma that has to do with the wrist pain, you should consult professional help. And I'm sure that these points can actually help you or help someone that you know, help them